I guess we'll start off with a little bit different picture now than a month ago. What has the adjustment been like within the entire health system?
Well, Adam, there are a lot of adjustments. Many of the um, rules and just boundaries that we've held for many, many years have been adapted out of necessity. And they're appropriate adaptations, but that's part of what makes this difficult, is we want to adapt and we want to be proactive. We don't want to go too far and make mistakes or need to wind back decisions that we make. So there are many, many changes, and there's a long list of state and federal regulations that have also been adapted to assist us in our adaptations, but steps that they've taken that we would not have anticipated.
Speaking of anticipation, I can only imagine that in your role there have been many talks, a lot of literature about what a situation like this would look like. What have been some of the key surprises to you that perhaps people didn't think would happen?
Well, there are, I don't necessarily want to call them formulas, but there are approaches and patterns that have been known for many, many years on how to approach pandemics. But the last real significant major global pandemic of this kind is nearly 100 years old. And so personal experience is such a powerful teacher that theoretic writings about these things, or writing about smaller epidemics or smaller pandemics and extrapolating them to one of this size, don't always capture all the things that you would otherwise have liked to have known. But I would say one of the biggest challenges is just the constant cultural, philosophical mind shifts that we're making. And we try to make those thoughtfully and with an evidence and scientific base. But we're emotional beings, and it's stressful for people. And so there grows out of that stress rationales for lots of things that don't always get balanced in the work that we do. So we're just trying to receive input from many sources, identify the most important fact-based information, and then make meaningful decisions out of that.
What's one of the perhaps misguided rationales that you've been trying to address over the last 2 or 3 weeks?
Well, misguided, I think. I'd rather not use that word because I would say that many of the rationales I hear come from a very earnest place,
Right.
and we're all searching for the best answer, and none of us are sure exactly what it is.
Right.
But early on, gosh, it doesn't seem like it's been that long ago when you look at a calendar, but it feels like a long time ago. 3 weeks ago, there were a number of our team members who were asking us about mask management and what types of masks to use and how to properly use them. And this is not unfamiliar to healthcare workers. And they were asking good questions. Some of those folks were asking questions then that we weren't prepared to answer, but today many things have changed about how we're using masks, right? So, for example, at that point in time, the incidence in the community was low, and so we were applying masks in focused ways. That at times was challenged. People would say, well, how do you know this disease isn't spreading faster than it is, or how do you know that it's not being transmitted on surfaces? And so we would regularly touch base on a daily basis with the CDC and so forth. And so a lot of those things have changed, right? So now we're in a universal masking scenario. And so there are some folks that I imagine are thinking, I told you so, we were going to get here. And it wasn't that I didn't imagine we could have gotten here. We were just trying to take it in a paced fashion and in a way that was consistent with what we're learning about this disease.
What has the morale been like amongst the staff, those who are in the rooms, in the hallways, entering the buildings every day?
I think they're stressed. Healthcare workers, I think, are a very resilient group of people. They prepare themselves in their career choice to confront difficult situations. They know that they will have emotional reactions to when their patients pass away. They will hold the hands of family members through very trying times. So these individuals prepare for that, and they take pride in their ability to manage that, and they do a wonderful job. But I think overall people are feeling uncommonly stressed because this is a very new scenario, and we don't have all the answers, and we want to protect them, and we want to protect our patients. And so the uncertainty of it, I think, has been unnerving.
When we talk about the surge, at this point, given the number of ICU beds that Rochester Regional has, the ventilators, the PPE, do you feel like you're prepared for a surge in our community?
Well, preparation is a continuous process. It's not a moment of arrival, and at least in my mind it's not. There's been incredible efforts, incredible good preparatory actions that have been put into place. There's still a lot of work for us to accomplish between now and the day that we may see a large surge. And we're working hard to understand the predictive models so that we can be as accurate as possible. And but if there is a massive surge in the community, it will be very difficult for all of us to get through that and to triage resources and to prioritize resources in a way that is for the greatest good.
We're only 2.5 weeks in since the first confirmed case, which, like you said, is just mind-blowing. Do you think you are encouraged or discouraged by the numbers you're seeing right now in our community?
Well, I would just say that it is what it is. And I prefer to try to channel my emotional energy to the positive and moving forward. And so I'm not discouraged by it. I'm rather quite heartened by the teamwork that I see within Rochester Regional Health, as well as in our partnership with the University of Rochester and the county. This is unprecedented collaboration, and it's healthy for all of us. So I'm very encouraged by all of that, and we will weather the storm together.
We talk about flattening the curve and allowing people to perhaps get back out in some fashion and in some areas. Obviously, a vaccine is the chalice that everybody's seeking. At the same time, we're talking about treatments, testing to see if you've had it. What are you looking at when it comes to safety in the community? What do you want to see progress the fastest here?
Yeah. Well, there are lots of what ifs folded in that question, but I think it's a good question to stay prioritized and focused on what we're doing and what really matters. I think that what really matters is continued social distancing and the commitment to that. And it's very awkward for all of us. And it's heartening to see people remind each other, oh, no hug, no handshake, or we'll deliver it at the door and that sort of thing. That's very, very important. That is fundamental for all of our safety and for this community's success through this pandemic. I think it would be a wonderful thing to have greater clarity around medication treatment availability. And though there are no clearly established treatment protocols, there are numerous efforts to identify potentially effective drugs. And the sooner we can have that, the better we'll all feel about this, and the better it will be for our community. It will be some time before the vaccine is ready, But when it is ready, and it'll be a great blessing for all of us, and for not only us, but the world. And I will remind the viewers that vaccination efforts have encompassed global efforts for years, from smallpox to polio and all of the vaccines. And so we will catch up with this, and we will one day look back and say, wow, we accomplished something really great.
We keep hearing about pneumonia in the patients that see the most severe symptoms. Is there a specific type of pneumonia they're seeing? Because they seem to be on ventilators for a lot longer than other illnesses.
Yes, so pneumonias do have different categorizations that are used, but this is a diffuse bilateral pneumonia. It's not localized to a single lobe of the lung, and it does have a characteristic appearance on CT scan, although it's not a specific appearance. This is a non-specific but characteristic description, and so patients with severe pneumonia do develop a condition called ARDS. It stands for acute respiratory distress syndrome, and this is basically just a failure of lung function and requiring significant ventilatory support.
Because it has more of a universal effect on the lung system?
Yes, that's right.
Wow. Is there anything else that you'd like to add that I might have missed?
I would just remind folks to remember all the good things in their lives. We're all adjusting to things that feel like takeaways. Things that feel like unhappy adjustments. But good can be found in those things. And the human spirit is an indomitable force for all of us, and we need to help each other stay focused on those positive things.